Hi, I'm Kelly, and those two little actresses are my girls. I will be talking about the ancient and modern history of influenza and also the causative agent. Let's get started. Ancient history of influenza. Hippocrates described symptoms of influenza about 2,400 years ago. With the arrival of Christopher Columbus to the New World came the arrival of many foreign illnesses, one of which was an epidemic that could have been influenza. It killed the entire indigenous population of the Antilles. The first recorded influenza pandemic occurred in 1580, where 8,000 deaths were recorded in Rome and several Spanish cities were depopulated. We'll discuss a few of the outbreaks in the past 100 years. The Spanish flu pandemic of 1918. This is the biggest influenza pandemic ever recorded. Between 20 and 40% of the world population contracted the virus. Among them was my great-grandmother, Mary, who was 27 years old. The mortality rate was the highest within her age group. She was also one of the 20 to 100 million people to die during this pandemic. Some people felt fine in the morning but died by nightfall. All influenza A pandemics have since resulted from the 1918 virus. The Asian flu and Hong Kong flu. The mortality rates of both of these pandemics were highest in the 65 and older population. There were 33,800 deaths during the Hong Kong flu, making it the mildest flu pandemic of the 20th century. The 2009 flu pandemic, also known as swine flu, was identical to the 1918 Spanish flu strain. Even though between 43 and 89 million people were infected, there were relatively very few deaths related to the virus. This is because of the availability and utilization of the vaccine once it was readily available. Similarly to the Spanish flu, mortality rate was highest in younger people. Causative agent. The influenza virus is in the family of enveloped viruses with segmented, single-stranded, negative-sense RNA genomes known as orthomyxoviridae. The genus is the influenza virus A, B, or C. Species, influenza A, B, or C virus. There are serotypes or subtypes, such as the Spanish flu and swine flu, come from the strain H1N1. Influenza virus A is found in humans, pigs, birds, and horses. Influenza virus B in humans, seals, and ferrets. And influenza virus C in humans, pigs, and dogs. The virus is between 20 and 120 nanometers in diameter, coccus or spherical in shape, and sometimes filamentous. It's transferred by droplet infection with sneezing, coughing, or spitting. The virus sticks to epithelial cells lining the respiratory tract by means of the protein hemagglutinin. Then the virus is drawn into the cell, where it sheds its coat. Viral RNA enters the nucleus of the host cell and initiates the replication of viral RNA and production of enzymes. One virus goes in, thousands to 1 million come out of a cell with the help of the protein neuraminidase. They can live 1 to 2 days on non-porous surfaces and 8 to 12 hours on porous surfaces. The influenza virus is one of the most changeable viruses known. There are 2 ways that influenza virus changes. These are called drift and shift. Drifting, or antigenic drift, is a change that happens when the virus makes small mistakes when copying its genetic information. The result is a difference in the HA or NA proteins. The changes may be significant enough so that the immune system will no longer recognize and fight off the altered proteins. This is why you can repeatedly get the flu and why flu vaccines are given each year to fight the current circulating strains of the virus. Shifting, or antigenic shift, is a quick major change in the virus, which yields a new combination of the HA and NA proteins. These new influenza virus subtypes have not been seen in humans, and because they are so different from existing influenza viruses, we have very little protection against them. When this happens, if it happens, and the newly created subtype can be transmitted easily from one person to another, a pandemic could occur.
All right, so in the next couple of slides, we're going to talk about a couple different things. First, where the virus comes from and where it's found. Second, some of the signs and symptoms individuals inquire. And finally, the degrees of severity influenza has to offer, including how it can affect those individuals already facing some kind of health issue. So first off, the reservoir. The influenza virus is found in the respiratory tract of mammals, such as humans, horses, pigs, dogs, and seals, to mention a few. It is also found in the intestines of birds. The virus is also located and found all over the world, with rates rising and falling in different areas depending on the season and vaccine availability. Next, signs and symptoms or clinical manifestations. According to CDC, regarding the influenza virus, here are some of the signs and symptoms given: experiencing a fever, chills, having a cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, and fatigue or tiredness. Some people may also experience vomiting or diarrhea, though this is said to be more common in children than in adults. From another resource, Mayo Clinic suggested these ideas for signs and symptoms of the flu: chest discomfort, head congestion, feeling nauseated, having a shortness of breath, swollen lymph nodes, and having a loss of an appetite. They did also mention that not everyone with the flu will have a fever, and you will start to feel sick sooner than later. It happens quickly. With all these signs and symptoms given, although you may not be faced with all of them, it makes it easier for clinicians to identify you have been diagnosed with the influenza virus. Next, degrees of severity. The flu can last 5 days up to several weeks, depending on the severity level in an individual, and even after the fever and aches are gone. An individual can still feel tired and drained for longer. According to WebMD, the flu can also be classified into severity by being diagnosed with the influenza A, B, or C virus, A being the worst and C being the least severe. A virus mainly comes from wild birds as its main host, and is the main virus for large flu epidemics. The A virus can also be found in animals. You are still able to recover if diagnosed with influenza A. It may take longer to recover, but you may experience more symptoms. The B virus is only found in humans. It is less severe than the A virus, and it does not cause pandemics. The C virus is only found in humans, ranked as the least severe, and hardly experiences any illness. It does not cause any epidemics, but it is more sporadic. While some individuals are quickly overcome from the influenza virus, there are instances where it can lead to pneumonia, bronchitis, sinus, or ear infections. So let me talk about a few illnesses that individuals are already faced with and the level of severity influenza can cause to make them even worse. First, individuals with asthma are at a higher risk of an attack, which you can see in the far right picture that their bronchiole is becoming more and more closed off. In some cases, an individual can be diagnosed with pneumonia, shown in the left picture, which is an infection that inflames air sacs in one or both lungs and may fill with fluid. And in most cases, it makes asthma symptoms worse. Another example would be individuals with diabetes. When an individual is diagnosed with the influenza virus and has diabetes, it can interfere with their glucose management, and it can eventually lead to diabetic coma and potential death. Statistics, according to the CDC, show that 29.1 million individuals are diagnosed with diabetes, so this could affect a lot of people. A final example is a person diagnosed with any kind of heart disease. It is mentioned by nfid.org that influenza can trigger a heart attack, and up to half of unexpected influenza deaths are due to heart disease. If an individual is faced with heart problems, it is recommended they are given the vaccination.
I'm now Gunter, and I'm going to talk about some of the ways that we can treat and prevent the influenza virus. We learned earlier that the influenza virus can be spread by sneezing or coughing. All of us are surrounded by tons of sneezing and coughing people everywhere we go, at school, at work, at church. And so it can seem pretty hard to contain a virus like influenza. And so what are some things that we can do to prevent the influenza virus? According to the Center for Disease Control and Prevention, the number one thing we can do to prevent influenza is to get vaccinated. Along with the vaccinations, there are several other things that we can do. 1. Avoid close contact with other people that may be infected with the influenza virus. If you're sick, stay home. Also, if you're sick and coughing or sneezing, cover your mouth and nose when you do so. And whether sick or not, clean your hands to avoid getting infected. Avoid touching your eyes, nose, or mouth, which are easy places for the disease to enter and cause an infection. And practice other good health habits such as exercising to boost your immune system, eating healthy, which also helps to strengthen your immune system, and even smiling, which can help to boost your immune system according to some studies. So the CDC recommends the use of injectable influenza vaccines. Those include the inactivated influenza vaccines and the recombinant influenza vaccines during the year 2016 to 2017. So the inactivated influenza vaccines contain a little bit of the influenza virus that has been killed or inactivated, so that it still has the antigens but won't make us sick, but will still allow us to create an immune response to the virus. The recombinant influenza vaccines, or they take a DNA coding for the antigen in the virus and insert it into the vaccines. Both of these ways allow us to create an immune response without exposing us to a live virus, which could potentially cause an infection. And these come in two different types. One of them is the trivalent vaccine, which helps protect against 3 different viruses. And 2 of those are an A virus, the H1N1, and the H3N2 viruses. And the other one is a B virus. And the quadrivalent vaccination also protects against those same 3 viruses, but also against an additional B virus. And so the CDC recommends that anyone 6 months and older be vaccinated for influenza, and that allows us to develop the antibodies necessary to protect us against influenza. It's also necessary to revaccinate each year because, as we talked about earlier in the presentation, the virus that causes influenza is able to change and shift and modify. But what if I still get sick? What are some things that we can do if we do get sick, even after getting the virus, or if we forgot to get the vaccination and we got sick? The treatment for influenza is rest and a lot of fluids. And for a lot of people, that can be enough. They can see their doctor and they'll be able to get over it fairly well. But for patients that need to be hospitalized, or people with a serious flu infection, or those that are high risk for complications, it's recommended that they take antiviral drugs. And that's going to be determined by their physician. And some of those antiviral drugs are Tamiflu, Relenza, and Rapivab. So to sum it all up, influenza is caused by the virus Orthomyxoviridae, which is an enveloped RNA virus. The reservoir is the respiratory tract of humans, and it's transmitted through droplet transmission, especially through coughing and sneezing. And in order to prevent influenza, it's important that we get vaccinated every single year, and also that we practice good hygiene. If you are infected, we're going to treat it with rest and lots of fluids, and also possibly antiviral drugs such as Tamiflu, Relenza, and Rapivab. And here's some of the sources for some of the information we have. Thank you.